to welcome everyone to the Conway Chair Conversations today. In particular, those of you who may not have joined us in the past. I wanted to just remind you what the Conway Chair Conversations is designed to do, which is to engage us in lively discussions and demonstrations about scientific ideas and topics about how we develop those ideas and use the methods. And in particular, we're going to learn today a new approach to how to organize research. The series of research discussions focuses on the evolution of ideas and designs, and each month our featured scholars share progress about their respective developments and their ideas. Uniquely in this program, we invite our attendees to become part of the program as conversationalists that can help influence the ideas and their development. And we may also ask you to make recommendations about how they can actually approve, and in this sense, the implementation. This series of conversations is sponsored by an endowment that was provided by the William and Joanne Conway Chair Scholarship. And you'll be introduced by our distinguished panelists today by Joanne after I introduce Mr. Joanne Wilson. But I want to remind you that we encourage you to unmute yourself and participate in the conversation. Joanne Wilson serves as a program lead for the Clinical Research Navigator program and is an informatics project manager with the Clinical Translational Institute at Children's National in partnership with George Washington University. With nearly 15 years of extensive research, program management, and experience from his involvement in over 135 clinical trials and 25 therapeutic areas. Joanne proudly serves our research community by facilitating research at all stages of clinical and translational research lifecycle. Working at the intersection of researchers, patients, families, and the community, as well as external collaborators and partners, his primary focus has been in developing those synergistic relationships amongst research stakeholders, external partners, in applying data-driven and real-world evidence-based methodologies to solve the research challenges and identify and overcome barriers to translation of the advancement in healthcare. Joanne also serves as a pediatric research mentor and an advisor to numerous research networks and a member of several professional research organizations. He holds a Bachelor's of Art from the University of Maryland and College Park in psychology, and also has a concentration with clinical and industrial organizational psychology, and is both a certified research professional and a member of the SOCRA organization. And it's really my pleasure to welcome him. He's also one of our distinguished scholars who participates in our actual program implementation. So Joanne, thank you very much for being here today. And I'll turn it over to you to introduce our panelists.
Thank you so much, Eileen. It's a pleasure to be here today among our many colleagues and our friends here. We're really excited today to present some very new resources that may be helpful to you, that will be helpful to both Children's National and GW. And I'm tremendously excited to share those along with my colleagues that are part of the CTSI. I'm going to share my slides. Can you all see them okay? Yeah, excellent. So today we're going to be talking about two tools in particular, the Virtual Organizer and the Data Science Accelerator. You may have heard of the Virtual Organizer as it is currently in use at Children's National and GW. It is accessible and it has been for several months now. But we're also very excited about a new tool that's coming down the pike, the Data Science Accelerator, which is really developed to help engage investigators and help get them the support that they need. So we're really working hard at that mission, and we're really excited to have these new tools to support that. Today I'll be joined by some of my colleagues within the CTSI and from GW who have spent a tremendous amount of time working on these projects and have utilized them. First, I'd like to present Trey Schulbaum, who serves as the project manager with the CTSI-CN. She has led numerous initiatives with the CTSIN and is in charge of projects such as the Data Science Accelerator and many others. We're very pleased to have her with us today. I'm also joined by Sheil Singh, who is a research program associate with the CTSI-CN. She really is our primary stakeholder at GW and really holds down the fort there and really ensures that we have substantial engagement with our investigators and research staff there. She also serves within the GW Health Sciences division, and we're very happy to have her with us as well. We're also joined by Dr. Ava Williams, who is within the postdoctoral fellow program within the Primary Care Research Training Program, or PCART, at the GW School of Medicine and Health Sciences. Dr. Williams is going to join us today as a user of some of these tools, who has utilized it in her research that she conducts to give a testimonial of sorts to really share how the tool functions and how it's supported her research. So without further ado, we'll go ahead. I should note that by way of financial disclosure, none of today's presenters have any financial interests, arrangements, or affiliations that we need to disclose that concern this presentation. So before we go into the actual tools, what we always like to start with is a brief introduction to the Clinical and Translational Science Institute. And we are the science institute that has developed these tools and that really provides a number of services to researchers at Children's National and GW. In short, what we are is we are your research support center. So any questions that you have about research at your institution, we're here to support you. Any challenges that you may have or barriers that you need to overcome, we're here to support you. And we do that across many different modes, and when we're really here to answer any questions you may have or help engage you with folks that can answer questions that you may have. We're led by Dr. Lisa Gay Woodford, who, in addition to the CTSI, also leads our Center for Translational Research at Children's National. She also serves at GW in a leadership and teaching capacity as well. Our co-director is Dr. Remer Bushart, who serves at GW and serves as the head of many initiatives and programs through the School of Medicine and Health Sciences. And our administrative director is Patrick O'Keefe, who also serves at Children's National. So to kind of explain the CTSI and what we are and how we became, it's really important to go back to NIH. We are funded through the Clinical and Translational Science Award, which is one of the most prestigious awards offered by NIH through their National Center for Advancing Translational Science. It's been awarded to just a handful of institutions across the country, 55 at last count. And what the purpose is to create these research hubs or partnerships among local institutions so that we can actually catalyze research. One thing that they noticed was that a tremendous amount of money is invested into research. NIH provides a massive amount of funding, but taking discovery from bench to bedside has always been a challenge. And so the hope is that these institutions that will be working together, not only locally, but also within the various hubs and among the various hubs, can really transform the way that we do research. So our institution was fortunate enough to receive one of these prestigious awards, and we are partnered between Children's National Hospital and, of course, our academic partner, the George Washington University. We were established in 2010 in version 1 as a partnership between Children's National and GW focused on 5 specific domains, primarily workforce development, so helping engage our early career investigators or trainees, as well as our research staff, to provide ways to excel in their career. Also collaboration and engagement. So that's not only collaborating and engaging with other investigators and other research staff, but also with the community, also with colleagues and collaborators that may exist in other institutions all around the country, and also with industry. So pharma, CRO, and other vendors and industry that may be able to support your research. Our third goal is really working on integration, basically bringing it all together. Many of us know that research has been traditionally siloed, and there's been different departments and many different places that are doing research in all different ways. And we really want to work to make it more consistent and streamlined. We're also focused with methods and processes, so really helping you conduct your research, making sure that you have the resources, the tools, the services available, and I'll explain some of those in the next slide. And then also, we cannot forget informatics and data and the important role that it plays in research today. Research practically cannot be conducted without informatics and without access to data, be it EHR data, be it the collection of data from other research purposes and aggregate data from these large data enclaves that exist. But we're really focused on bringing all this together to support our investigators and our research staff at both institutions. We were fortunate enough to be refunded in July 2016, and we really wanted to hone in and focus on CTR. And what we really want to do is help support child health and have an emphasis on child health. And we're doing that through these innovative approaches and enhanced capabilities in these areas. So that's kind of a historical context of the CTSI, but we're also, of course, always looking at the future. And we have submitted a grant for our third iteration of CTSI. And you'll see that much of the things that I've described, we're continuing to focus on. Advances in data science, focusing on community and collaborating with them, helping build the pipeline of translational endeavors, empowering investigators, really giving them the tools and the resources they need to conduct the research, transforming trials by doing more multi-site trials, collaborating with other institutions, promoting those connections, and then also kind of highlighting some of our strengths. And we have some optional modules in which we do that. And what we're really focusing on is we're continuing to focus on CTR, but we really want to do it with a health equity lens. So we're really focusing on that. As we all know, over the last several years, that has become more and more important, and we want to make sure that we are implementing those principles into our research. So as I mentioned, CTSI-CN is your research support center, and this is for children's and GW. I always emphasize that because it's very important to note that we serve both research communities. But we provide a number of resources, tools, and support that really can help you with your research and also help you with your career development. So one of the first domains is through education. You'll notice that GW has clinical research programs, graduate programs. Those are managed and supported by the CTSI-CN. We also have a certificate program and some other programs. But in addition to those more formal academic programs, we do also offer seminars and workshops. So we routinely each month are doing trainings, be it in informatics or grants enhancement or other areas, so that we can really help inform our researchers at both institutions. We also support study design, so recruitment tools, also data management and data analysis tools. A major one that you may have heard of is REDCap, which is prevalent and ubiquitous at both institutions. The CTSI supports those efforts. And then also biostatistics and informatics support. So we do have in-house statisticians to help support you with study design, to help with analysis of the data that you've collected, and everything else related to data and informatics. By way of study conduct, the clinical research unit located at Children's National on the 3rd floor is also supported by the CTSI-CN. We have a cadre of clinical research coordinators and clinical research nurses who can help support your research directly, who can perform tasks to help coordinate and manage your trial or your study. We also, as I mentioned, have informatics tools and support, and then also with multi-site engagement. So we're part of a massive group of collaborators on many different projects. One of the most important being the Trial Innovation Network. And so this goes back to the CTSA program more broadly, where you have the 55 plus hubs that are working together, and we really support multi-site research. So if you need single IRB support, if you should need access to other investigators to review your protocol, if you're in the early stages of writing a protocol, if you need assistance with recruitment, maybe you're doing a multi-site study or you're doing a rare disease study where you need to engage with patients that may not be in the Washington, D.C. metropolitan area, and so forth, we're here to support you with that and help make those connections. And then even once you've finished your research, once you've collected all of your data, we're here to also help you disseminate it. And we do that through events such as the Science Cafe, where you can meet with the community in an informal setting and explain the type of research that you conduct. You can get ideas and feedback from them, and it's been very constructive and very helpful to many investigators. We also offer community consultations and some other programs to help support your research. So with that, and that background of the CTSI-CN, I'm happy to transition to the topic of the day, which is our tools that we've developed, namely the Virtual Organizer and the Data Science Accelerator. So I will pass the baton along to Sheil so she can talk about the Virtual Organizer.
Thank you, Joanne, and thank you everyone for having us today. I'm really excited to share with you this new tool that we have. We've been working on it for quite some time now. Again, my name is Sheil Singh, and I'm a research program associate at GW Health Sciences, as well as the GW site lead for the CTSI-CN. And so today I will be sharing with you our Virtual Organizer, which is one of the newest tools that we've developed via the CTSI-CN. So before I proceed directly to the tool, I'd first like to give a little bit of background as to how this tool came to be. So in the summer and fall of 2020, the CTSI-CN conducted focus groups with about 40 to 50 early career investigators and asked them about their experiences navigating the research process. So many expressed difficulties, finding appropriate resources that address their initial questions, things that helped them plan. Other issues included having to sift through exhaustive sets of resources, which were most often really disorganized, and they really had to dig through multiple websites to find one or two useful links. So using the results from these focus groups, the translational workforce development team at GW, which at the time included myself, strived to make the research process as easy as possible for investigators and research staff. So we began curating content that would not only help address gaps in research support, but also help provide a foundation for individuals navigating various aspects of clinical and translational research. So we curated content from both local and national resources. So for example, we partnered with Himmelfarb Library at GW School of Medicine and worked with their team to identify lasting high impact resources. We also sought feedback from all the module leads at CTSI-CN who worked with their teams to provide resources that they felt would be most useful to investigators and research staff. And so the resources you'll see in the Virtual Organizer are a direct result from multiple collaborations and rounds of feedback from investigators and scholars in the CTSI-CN community. So as you can see, the Virtual Organizer is organized around the 8 steps of the research cycle. So we have research question, research team, study design, protocols and compliance, funding, proposal development, conducting the study, and reporting results. So the Virtual Organizer is meant to connect investigators, staff, students, with training, tools, resources, and navigators such as myself and Joanne. And the overall goal is to not only have a one-stop shop for tools and training, but to also improve accessibility to CTSI-CN specific resources as well. So as I'll soon show you, the Virtual Organizer is highly curated and simplified, so users are not stuck perusing a laundry list of resources at each stage. And so with that, I will continue to the Virtual Organizer. So this is our homepage, the CTSI-CN homepage, which was recently launched earlier this year. Please note that the domain is exactly the same as the old CTSI-CN website, ctsicn.org. We've just reorganized the content for easier access and viewing. And so I also encourage you to peruse the new website if you haven't had the chance to already. With the Virtual Organizer, you can find this by clicking here on the first navigation bar, which will lead you to the home page with access to each section. So you'll scroll down here and you'll be able to click on any section you need. I'd also like to point out we have a little video testimonial section. So if you're looking to see what other CTSI-CN staff have to say about certain sections and how they use it, this is also a great resource. So I'm going to go ahead and use just a common example. So let's say I'm a graduate student and I need help with data management. So I'll look around here and see, oh, manage your data. Great, conducting the study. Let's see what resources we have here. So for each section, all of the resources have brief descriptions underneath telling you what it's about. And for instance, like in the case of REDCap, where there are multiple instances of a tool, so you can have it available at GW or for children's affiliates, both of these will be listed. So tools like Protocol Builder or even services like grant assistance are linked to support services provided by GW and Children's National. Additionally, each section has resources pertaining to promoting health equity in your research. So sometimes it's quite obvious. For example, here we have Access a Health Equity Toolkit. But we have other resources that are interwoven a bit more naturally. So for example, if I go under proposal development, we have one here. So guidelines for inclusive clinical research. So we've done it this way so that health equity is shown as part of the research cycle, not just a separate or adjacent section. And so we really hope that these resources help investigators design and disseminate research that is equitable in their field as they navigate through the research cycle. Another thing I'd like to point out is each section has an institutional contacts tab. So I can show you here. And so the institutional contacts tab, I would really encourage you to use this if you are looking for more personalized support for your research task or project. And the institutional contacts are most often divided evenly between GW and Children's National, so you'll most likely find help regardless of your affiliation. So for example, protocols and compliance, we have Children's IRB, as well as GW's Office of Human Research. An example of a more local resource in the virtual organizer, like I mentioned earlier, we've also developed content specifically for the VO. So for example, we had one of our professors here, Dr. Melissa Tice, she adapted one of her classes to create a series of videos outlining clinical study protocols. And so she was able to adapt that, and we worked with her to create specific content. So I won't go through each section for the sake of time, but there are a few key features I also would like to highlight as well. The first is the chat feature here on the bottom right that you can see has probably been popping up a few times. It's currently online, and we typically have it open for questions on a standard Monday through Friday, 9 to 5 basis. And there is an actual navigator behind this chat. So you will be talking to a person. It's not a robot. And if navigators are unavailable to chat, the chat will show as offline, but users will still have an option to submit a ticket, which we're able to pick up at a later time. And we'll continue to keep in contact with you via email to answer questions. And so we're usually able to respond within a 24-hour period. So expect a response if you were to submit a ticket through the virtual organizer. And once we begin receiving even more questions that become more common, we'll eventually be able to collect enough data to create a frequently asked questions section as well. So you can look forward to that. The last thing I'd like to point out is we also have a calendar of live events, such as trainings in the responsible conduct of research or conducting statistical analysis. And this can be accessed one of two ways. The first is through the About Us tab. Here on the right, we have events, and we have specifically a virtual organizer calendar. And so all of the events on the virtual organizer calendar are color-coded by stage in the research cycle. And so if you want to see events that are specific to each section, you can do so within each section as well. So if I were to go to, say, conducting the study, and down here in events, I could see exactly the upcoming events that are related to conducting the study here. So 2 options. We also have an event submission page where investigators will be able to submit events they'd like promoted on the virtual organizer as well. And so this can include CTR related lectures, health equity workshops, trainings in data analysis, etc. And so that is it for a quick tour of the VO. But I do want to point out that this is an evolving resource. So we are always in the process of reviewing resources and adding content, taking off content that people don't find as useful. So if you have resources that you think would be beneficial to the virtual organizer, please feel free to contact us at the CTSICN via email or the website's chat function. We always appreciate your ideas and contributions you may have in mind. I'll do a quick plug to sign up for the CTSI-CN mailing list, quick and easy on the website as well. And so with that, I will pass it on to Ava Williams, who will tell you about her experience using the tool as a postdoctoral fellow in GW's primary care research training program.
Hello, everyone. I am happy to be here today to share my experience with the virtual organizer. I am a research fellow in the primary care research training program here at George Washington University. And my research focuses on designing a medication management and reconciliation study to address polypharmacy, patient safety, and patient-centered communication for older adults. As an early career researcher, the virtual organizer has been an invaluable tool. The virtual organizer is designed to help guide researchers through each phase of the research process. And I use the virtual organizer to help prepare me and help guide me through the research process. What I like best about the virtual organizer is that everything you need to conduct a research study is in one place. There is also added benefit of having a real-time support to ask a question through the chat feature, which allows you to get additional information if you have trouble finding a question or resources that you need. There are additional things that I really find extremely helpful about the virtual organizer, and that is the resource and the instructional context that's embedded in each cycle of the virtual organizer. I've found numerous trainings, tips, and resources that have helped prepare and guide me through my research. It's also nice to have a tool that's available to help answer any questions that you may have or questions that you didn't even realize that you had. For example, I soon will be conducting my research project, and the tools that looking ahead at the virtual organizer tools, I'm able to go in and find information on recruitment and data management, as well as health equity tools. And these are all extremely helpful and have been able to guide me through this phase of the research process. And as I look back on the research project when I first got started, I didn't know about the virtual organizer. And now that I know about the virtual organizer, it's extremely helpful that there's a tool that pulls everything together in one place where I can find everything that I need. And the design of the virtual organizer is also helpful because it allows you to look at it in stages and makes everything easily accessible. So my suggestion to early career researchers is to navigate through the virtual organizer before beginning your study. There's a great wealth of information on how to get started. For example, there's information on how to develop your writing skills in addition to preparing for IRB submission. There's also many different tools and tips available for developing as well as conducting your research study. So I recommend that the early researchers use the virtual organizer as a great way to prepare for their research and as an excellent guide as you move through the phases of your research. So thank you.
Thank you so much. Excuse me, sorry. Thank you so much, Ava. That was just tremendous to learn how the virtual organizer has helped in a real case scenario to see how it's really helped you with your research that you're conducting as part of that program. And thank you so much, Sheil, for the overview of the platform. It's a tremendously useful tool, and it's great to see its many different resources and facets and how to communicate with navigators and so forth. So we're very thankful for both of you. I'd like to turn over now to Trey Schulbaum to talk about something that's coming in the future, something that hasn't gone active yet, but has been in the planning phase for quite some time, and Trey has put a tremendous amount of work into this, along with some other members of our team, and we're really excited about it. Trey, the floor is yours.
Thank you, Joanne. Thank you, Shill. Thank you, Ava. And thank you all of you for joining us today. I'm really excited to give you guys a sneak peek into the DSA. It's been wonderful working on it. It's been wonderful to hear so much feedback about this tool from our research community. So I'm excited to give you guys, I guess, a first look into something that's going to be going live shortly. What is the DSA, which is what I'm going to be calling it for this presentation. So the DSA is a structured, collaborative, consultative environment that provides you, our research community, a cohesive one-stop support to help you with your research, as opposed to what we traditionally have done, which is a series of one-off consultations and handoffs. So now navigators like myself, like Joanne, like Shill, a couple of folks on this call are going to be assembled to help troubleshoot issues and help you enhance your research designs and implementations. And as you heard a couple of times during this meeting, we are really your research support center. We are here to help you. And it was really important for us to create a really seamless environment platform for you to access support from us. So the DSA is really complementary to the virtual organizer. So if you need a little bit more support, if you need that face-to-face engagement, we are here to support you in the DSA. So I think it's important for us to go back in time a little bit, because sometimes when folks hear Data Science Accelerator or the DSA, they're a little bit confused as to the name. So initially, the utility for the DSA was to provide folks with data. And then we decided to include big data on top of that. And as we continue to work and really enhance this tool, we realized that this should be accessible to our entire community. So it doesn't matter if you're looking for data or clinical research support in terms of personnel. It doesn't matter if you are needing support in grant development. We want to provide a one-stop shop for you. So the DSA is available for our entire research community, not just those who work and scrutinize data. So definitely stay tuned because we plan on hosting focus groups to really help us pivot in that name and help us get a name that's a little bit more inclusive for our entire research community. So stay tuned for our focus group, and I'll talk a little bit about that at the end. So again, I think during Joanne's presentation, as well as Shill, we talked about how the tools we provide is truly for our entire research community. And here are a couple of titles, but I'm sure there's a number of other departments, titles, and folks who really will benefit from the tools we provide, specifically the DSA. And again, this is just a number of, a number of different types of services, tools we provide to our research community at GW, as well as children's. So proposal development, regulatory support, clinical trial support, data, resources, and access. Really, our catalog is pretty extensive. So we're excited to be able to provide you with those resources. So once the DSA goes live, it's going to be in a number of places. The main place is going to be settled in is our main website, the CTSICN.org website. So once we go live, you'll be able to get consultative support starting at the CTSI-CN website, but you'll also be able to do so, as Shill mentioned, via chat. We can start a conversation via chat, and we can have a meeting, a more structured meeting via the DSA. You'll also be able to book consultations in other types of platforms. So we're really excited to start pushing this out to our community. So this is just a high level framework of the DSA itself, or the intake form, how you go about requesting that consult with us. So you complete a pretty simple intake form, which I'll show in the next slide. And that intake form is going to include a scheduling component for you to actually meet with us at your desired time. And then during the meeting or during that consult, we're going to talk through your needs, and we're going to create an action plan. Us navigators are really have that expertise in our specific area. So if you're looking for data, we have a informatics navigator to help support you with that request. So we want happy customers. So once that request is complete and you are happy, our job has been done. So this is just a mock-up of the intake form process. This is not an actual piece of how the intake form is, but I definitely thought it was important for you all to get a sense of how the process works and how that intake form looks like. So important information, we want to know whether you're at Children's National or GW, whether or not you would like to meet with us on site or remotely. And it's also important for us to engage you in the sense of, is this a follow-up initial consult, or is this a wraparound? And wraparound is really, really important for those who are new to the research world, maybe new to children's, maybe new to CTSI-CN, and they just want to meet with a number of navigators to get a sense of what do we have to offer in our catalog. So the wraparound option will be perfect for you. And then, of course, the important question is what area of research we can help you with. And then the second screen or process you see here is that scheduling component. So you can pick a time to meet with us. And then the third process is just uploading any relevant files that would help us with your consult. And then last but not least, of course, just putting in your demographics information. And then you'll receive a confirmation email that's going to have a ticket number associated with your request. You'll know who you're going to be meeting with. You're going to know what format, the ability to reschedule your meeting with us, and anything, any other questions that you may have, you'll be able to reply to that email and speak to a navigator. So this is a high level framework of our consult. So it's important for us in that meeting to really start off with your needs, how we can assist you. And based off of that, that's how we respond to what we can offer you. And during the meeting, during that consult, we start discussing that action plan. We start discussing how we can best give you a solution. So it doesn't start after that consult. We try to work during that meeting to really get you the best answers as possible. How do navigators help you? So navigators really have that expertise to know how to best connect you with resources and tools, faculty expertise, potential collaborators, community stakeholders, and different types of project management support. So our navigators really have a lay of the land and understand when we are meeting with our research community, how we can best assist you. So we are excited to do a soft launch this upcoming June. So if you're interested in being a part of that soft launch, I'll put my email in the chat. But we're going to do a soft launch with specific groups. And then we plan on doing a full launch this fall. So we definitely want you to stay connected with us via our newsletter, via our social media handles at Twitter, LinkedIn. Stay connected so you can be one of the first to just utilize the DSA and utilize the support we have to offer. And I'm happy to take any questions if anybody has them.
But thank you so much, Trey. This has just been very insightful, and it's always nice to see a new tool, something tangible that we can work with to really help drive that engagement. And so I'm really excited for this because it's going to take what we have been doing, these kind of one-off consultations, to the next level. It's going to really help us engage our investigators and our research staff across that research lifecycle. So it's really, really exciting. So thank you. I'm going to share one more slide here just to help drive our discussion and our questions. The great thing about these Conway Chair meetings is that it's a chance to engage with a really diverse group of researchers at Children's National and GW, and really kind of elicit feedback and learn from you. And with this tool, as Sheil mentioned, we really want it to be in an evolving state. We want to optimize it. We want to make it better. We want to continue working with it so that it can really serve your needs. So we have a few questions that we hope helps drive the discussion and some things to think about as we continue to discuss here in the next few minutes. The first is, what is your overall impression of the Virtual Organizer and the Data Science Accelerator? Then also, by way of the different resources and tools that you saw in the Virtual Organizer, are there tools that you regularly use that you would expect to be part of it or that you'd like to see part of the Virtual Organizer? Similarly, with the DSA, are there services beyond what we presented that you think would be beneficial as you conduct your research? And then finally, we really want to focus on how we can best engage our researchers and get them interested in these types of tools to really get the message out there. How can we better engage with our researchers? You know, right now we do have our website and we do consultations and we have the Navigator program. And these tools are going to hopefully optimize the way that we connect with our researchers. But what are some creative or innovative ways that we can connect with them? So those are a handful of questions that we have in regards to the VO and the DSA. I do see that we have a couple questions in the chat that I believe Trey has already addressed. So the first question we have is, are there costs associated with these consults? And as Trey responded, there's no cost for consultations. In fact, many of the resources that we offer and the engagement that we have with you cost nothing. It's offered as a service to support our investigators free of cost. Now, there are certain services, as you can imagine, like statistical support. If you're working with a statistician, there may be a cost associated with that, or the development of a database, or research coordinator support, research nursing support. There will be a reasonable cost associated with that. But as far as consultations and our engagement with you to help support you through the DSA or the VO, there's no cost associated with it. Are there any other questions about the VO or the DSA or any feedback to some of our questions that we've posted here?
Eileen.
Hi, Eileen.
Thank you. Looks so interesting. I have a question that's more about a communication strategy. If I was a nurse investigator and I was conducting research about families, and I wanted to make other investigators aware of kind of an add-on question about and ask them to embed, you know, one additional question in an existing study that might be conducted at Children's. Which of these mechanisms, or would either of these mechanisms, make it possible for me to scale up my research so that I could ask a question or have other investigators know that I was interested in having a family research question embedded in their study protocol?
That's a fantastic question, Eileen. Thank you for that. I'll let the subject matter experts, Trey and Sheil, address how the DSA and the VO can specifically help with that. But more broadly, the CTSI can really help with that. One of our primary goals is to help you engage and to help you expand your network when you're conducting research. And so we have a number of tools that can help with that, such as the VO and the DSA, but also through the Trial Innovation Network and through our connections internally in Children's National and GW, we can help you connect to get that type of feedback. Sheil and Trey, would you like to address how these tools in particular could help support that?
Sure. So I don't know if I should pull up the VO again. I think I'll leave it, but there is a protocols and compliance section on the Virtual Organizer. And so the first thing I would do is encourage anyone to go through the static resources on the Virtual Organizer. You know, there are a lot of best practices for protocols and things like that that will lead you. And if at that point you still don't have an answer to your question, I would encourage one to go to the institutional contacts. Because, you know, and of course I'm saying this at the point where we don't have the DSA launched. So at this point in time, I would encourage one to go to institutional contacts to be able to talk to a person about answering that question. But in terms of answering a question via the virtual organizer, it's very broad, and then it's kind of like a funnel, right? You start very broad and you kind of work your way in. And so I always, in terms of an order, static resources, and then a person. And of course, even the chat function at that point, if you are low on time and don't have time to peruse everything all at once, I would just recommend the chat if it's open, or submit a ticket and you're guaranteed some sort of answer or connection within 24 hours.
Yeah, and I think Joanne, you guys answered that perfectly, but I think I'll also add that some folks, Eileen, to your point, some folks may not have a good sense of the institutional lay of the land. So the DSA is really perfect if you're trying to get an understanding of who's who and what's what. So I would really encourage folks that if that works better for you in building relationships, start with the DSA so we can help guide you into understanding how different departments work, whether it be at GW or at Children's. I think that the DSA works perfectly in that way.
Thanks, Sheil. Thanks, Trey. I completely agree with that. And just to echo, the DSA is really designed to be our medium for offering you support. And it doesn't have to be a specific question. It doesn't have to be a specific resource or a tool. If you have a general question, or if you have encountered some barrier and you just want ideas or support as to how to overcome it, going through the DSA, or even to a different degree, the chat function and the VO, there's somebody live on the other end of that engagement who can support you, who can help you, who can walk through the challenge or the issue with you. And even if the navigator doesn't have that specific answer, because we're so well engaged throughout the institution, we can work to connect you to folks that can help answer those types of questions.
Absolutely.
Thank you.
Great. Thank you, Eileen, for that great question. Do we have any other questions or any feedback related to the questions we've asked on the screen? Don't be shy.
I think I'll just chime in here. Just knowing who to contact if I'm a group or if I have a study team. I'm just going to say this in general. What's the best way to invite more detail so that you could present it to my study team, for example? Just reaching out to you, or to, is there the chat function? Is that how you'd recommend I connect with a group?
Yeah, great question. So there's, as you can tell from the presentation we've given, there's a number of different ways to connect with us or to contact us. Until the DSA goes live, one of the best ways to contact us and get direct support if you have a question like that would be to email the CTSI Navigator email address, which is in the chat function of Zoom. I put that there along with our website. And with that, you're also going to connect with one of those navigators who can really help support you and help walk you through that question. So there is that. If you want to use the chat function on the website, again, that also will connect you to a live person who can help with that. And I would also encourage folks to visit our website, CTSICN.org, where there's a tremendous amount of information, institutional and otherwise, to help support your research, and where you can become familiar with many of the resources and the tools that we offer. So there's a number of ways to connect with us. Any way you connect with us, we'll be there for you. We are your research support center, and we'll make sure that we help you. Does that answer the question, Eileen?
I was just trying to ask it for all the investigators that are on. So I think that's great. And then
also, there's one question regarding when the DSA will go live. So right now we have a soft launch planned for this summer, June. We don't have specific dates, so definitely just stay tuned to or if you haven't subscribed, subscribe to our CTSI-CN newsletter, just so you can be in the know when that's going live. But we plan to do a full launch this upcoming fall. So right now in the June launch we're going to have a couple of services available, a couple of things available, but we plan slowly but surely ensuring that we add more functionality and features to that. So definitely just stay tuned. If you can subscribe to our newsletter, follow us on Twitter, you'll be able to stay in the know.
Awesome. Thank you, Trey. We do have another question in the chat. Additional services question. Stat support is appreciated in study design / write-up, and lack of funds can be a barrier. That's actually something that many folks reach out to us about. They face that very same challenge. And what the CTSI has done historically to help support investigators and researchers in that predicament is we routinely offer vouchers. So in the past, you may have seen advertisements or promotional materials for our health equity voucher and other vouchers that we have provided to help support covering the cost of things such as, statistical support, coordinator support, study design support, things like that. Another thing that I would note is that our BIRD module, which is part of the CTSI that's focused on, I always have to remember, epidemiology, biostatistics, epidemiology, and research design support. Sorry, it takes me a minute to remember that. There's a lot of acronyms going around. They actually offer 4 hours of free support. So if you need help with your study design, with developing your endpoints, determining what data you need to collect, power calculations, things of that nature, they actually offer to investigators 4 free hours of support just to talk through your challenge, to talk through the question that you have, and really help line up some support. And I've heard feedback from many investigators that said that within that 4 hours, they essentially got all of the answers they needed and were able to proceed with their research. So I'd encourage you to reach out to us or visit our website to learn more about those programs, and we'd be happy to help you. If you have additional challenges, you can use, of course, the DSA when it goes live, or you can reach out to CTSI Navigator, and we'd be able to help you there. We have just a few minutes left, and so what we're really interested in is you saw some of the tools and some of the resources that are available. I know we went through them kind of quickly, but are there any other tools that you think we need to add? Any other resources, any other services that the CTSI could provide to help you? And it might be helpful to think of the research that you're conducting currently and any barriers or challenges that you have. And that may give us an idea of how we can optimize these tools to provide you the resources you need. And anybody think of any that they think would be helpful? Well, of course, if you do think of any in the future, please feel free to reach out to us. As Trey mentioned, we are going to be doing a soft launch coming up next month. And if you'd like to be part of that and you'd like to experience the DSA and how it functions, that would be really, really great. In the chat, I do see examples of protocols would be helpful. Also, do you have anything on translation of resources for participants? Sheil and Trey, do you want to cover that as far as the VO and the DSA?
Sure. So for protocols, Protocol Builder actually has a lot of different templates, but I'm not thinking, now that I'm thinking about it, I'm not sure if the description actually specifies that tool offers that. So that's something that I can make sure to add. And then in terms of translation of resources for participants, off the top of my head, there might be one or two within conducting the study, but I can't think of them off the top of my head. So in terms of making sure that that's there, I'll have to go and look back, but that's an excellent recommendation. So thank you.
Dr. Lubin, I'm partially on Zoom today. You might want to look at some of the materials that have been prepared by the NIH on trial participation. NHLBI in particular has an excellent one, and there are also some others, and maybe Sheil could agglomerate them into one location.
Yes, thank you. I'm taking notes. So.
Thank you, Dr. Lubin. We have just a couple minutes, and we did get one more question in the chat. Ava, this question is directed towards you. Have you used the virtual organizer to keep your study team informed about next steps?
No, I haven't used it to keep the study team informed. We usually have regular meetings, weekly meetings, so I haven't used that feature of the virtual organizer, but I'm sure it's a great resource that others could use to keep their teams updated.
Well, thank you, Ava. And just a reminder, you know, we really are trying with the VO and the DSA to offer a very broad, robust cadre of resources and tools. But for your particular study or the particular project you're working on, you may not need everything. And that's really the great thing about the DSA is we're really hopefully going to give you kind of targeted support so that you're getting just what you need and you're not going to be overwhelmed by all of the other things that you don't need. They'll be available, of course, if you should need them or if the situation should change. But with the DSA, when we have that personal engagement, we have that live consultation or that remote consultation, we're able to put together a plan for your study to help provide you the support you need based on the protocol and based on our discussion. So we want to make it as robust as possible, but not everyone's going to benefit from everything that the VO or the DSA offers.